Media reports say that Israel has told the United Nations it will halve the amount of aid agreed upon into the territory, citing the slow return of hostage remains. UNICEF and other humanitarian agencies are calling for all crossings to be opened. Thousands of tons of food and medical supplies are waiting to enter Gaza.
As a fragile truce appears to hold, people in Gaza are getting on with the basic business of survival, returning to the ruins that were once their homes and desperate to feed their families. After 2 years of war, the situation on the ground is dire. Food, water, fuel, and medicine are desperately needed. Despite calls for urgent and unhindered humanitarian relief in accordance with President Donald Trump's peace plan, aid is moving at a glacial pace. International groups say it must come faster to save lives.
Now, when it comes to the aid, the answer is no, not yet. The shift has not yet happened. We are still witnessing, only few trucks coming in and large crowds approaching these trucks in a way that is absolutely not conform to humanitarian standards. So figures are talking about the need for 600 trucks per day for 6 weeks to alleviate some of the first needs. I think we are not yet there yet. We are clearly not yet there.
Border crossings, which serve as critical entry points for aid, remain heavily restricted. Israel says that's because Hamas has failed to return all the bodies of hostages it is holding as part of the U.S. brokered ceasefire deal. Security concerns and logistical challenges have further slowed the process, adding to the misery and frustration for hundreds of thousands of Gazans.
With the ceasefire holding for now, aid groups are racing to get life-saving supplies into Gaza. UNICEF and other humanitarian agencies are urging Israel to reopen all crossings so trucks can roll through fast. Thousands of tons of food and medical supplies are waiting at the borders with Egypt and Jordan. Up to 600 truckloads of aid are expected to enter Gaza each day under the terms of the first phase of the ceasefire deal. For more, let's cross over to Tess Ingram. She's a communications manager at UNICEF and joins us from Gaza. Welcome to our program, Tess. You are in Gaza, as I just said. How has the situation changed since the ceasefire came into effect?
The biggest change that we have seen has been the movement of people, hundreds of thousands of people being able to return to their communities and finding, in many cases, destruction. I spent the last 3 days in Gaza City talking to families who've recently returned there after what we know 2 months of really intense Israeli bombardments in that area. And the destruction is hard to explain. It's incredibly difficult for families who are going back there and really struggling to set up their lives again. I met a family today, in fact, who are walking a long way to find food or water from the ruins of their homes, scraping rubble out of what used to be their living room and really trying to think about whether they can stay there, whether it will be possible.
You are in constant touch with people there. UNICEF, of course, focusing especially on children. It is a time of hope, but also of tremendous uncertainty. What is the mood like from what you have experienced?
The mood, I think, as you said, is uncertain. People had this immediate feeling of relief. I've survived. This is over. I can go back to my home. But then that was followed by grief and loss as the reality hit and people started to think about that this is still their life now, that they're continuing to suffer, continuing to struggle, and of course coming to terms with everything that's been taken from them over the last 2 years, their homes, their loved ones, their dreams for the future. And now I think there is an uncertainty of if this ceasefire will hold. People are apprehensive and we're asking today, do we know if the ceasefire will hold? So it really needs to. Our call remains for this ceasefire to be upheld from all sides so that we can get the massive amount of aid into the Gaza Strip that's needed. And of course, so that the bombardments no longer kill and injure people here in the Gaza Strip.
Israel accuses Hamas of not fulfilling their part of the ceasefire agreement and has announced the Rafah border crossing will remain closed. How big a step back is this from a humanitarian perspective?
It's a real shame because the Rafah crossing before it was closed in May 2024 was the main aid artery into the Gaza Strip. We used to bring hundreds of trucks in through the Rafah crossing, and the idea that we were going to have access to that crossing again was going to be a game changer for the humanitarian response, and it's desperately needed. We need aid to come in through all available crossings in order to hit the number that we want to, which is 500 to 600 trucks every day for the foreseeable future. At the moment, there really is only one main crossing and a secondary crossing. So we really need that third crossing in Rafah to open, and then the two crossings in the north as well should open so that we can bring aid directly into the northern Gaza Strip.
And if that happens, what would be your top priorities and, the biggest obstacles that you could encounter along the way?
So we are already bringing in aid. Since the ceasefire was put into effect on Friday, we managed to bring in tents, tarpaulins, winter clothing for children, hygiene kits. So the trucks are moving, but of course we need more crossings to open and the volume of aid to increase. Our priorities at the moment are really on life-saving needs for children because the stakes remain so high. Diseases are spreading, winter is just around the corner, and of course a famine remains in Gaza City. So we're really focused on bringing in nutrition treatments for children, making sure that clean water flows to families wherever they are, and bringing in shelter and warm blankets and clothes for children to help them survive for the winter.
It's Tess Ingram, Communications Manager at UNICEF in Gaza. Thanks so much, Tess.
Thank you.
And we can now speak to Amjad Shawa. He's the head of the Palestinian NGO network in Gaza City. Welcome to DW. I'd like to start by asking you about this announcement by Israel that it will only allow half of the agreed number of aid trucks into Gaza. What's your reaction?
It's shocking that we received this news about the decreased amount of aid supplies to Gaza, while Gaza is still under the famine conditions, under such shock that we had because of this intensive destruction happened, not only in the homes and the infrastructure, also in the water facilities, the health facilities, which was destroyed. And while we have the joy, this optimism on the future, Israel continues shocking us by this news of closure of Rafah crossing. You know how much thousands of these patients, injured people who are waiting in order to leave Gaza through Rafah crossing to get life-saving medical treatment outside Gaza Strip. Also, Kerem Shalom crossing or Karm Abu Salim crossing, the only crossing is still open, that they will decrease the aid trucks to get in Gaza. These trucks, which is carrying life-saving supplies to the people of Gaza, any decrease will affect the efforts of the issue of facing dealing with the malnutrition children, or in the health facilities who need medications, for the chronic patients. We are living day by day. So the meaning of this, that
sorry
Israel...
to jump in, but in these 5 days since the ceasefire began, there has been an improvement of sorts. Can you tell us how much headway you've been able to make in terms of bringing aid and assistance to the people in need?
Yeah, it's a good question, really. It was Sunday when it's the starting day of the application of the humanitarian protocol, which is part of the deal of ceasefire. On the first day, there is about 800 truckloads. Only 172 trucks of humanitarian aid belong to the UN agencies and the other humanitarian organizations. And there is some regional organizations also entered tens of trucks of aid supplies, but the majority of the trucks were private sector, which is food items. And, 90% of the population lost their incomes. They cannot buy. So the case here of yesterday, there is nothing entered, the swap deal, and the crossings were closed. Today is a religious day for the Jewish religious day, so the crossings are closed. So we are dealing with the Israelis who are completely control everything and not letting just a tiny amount of aid supplies to the Gaza, whilst we are not, no shelter items enters, we are in need for 300,000 tents in order to be provided to these families who lost their homes. The estimate of people who lost their homes in Gaza Strip, 1.5 million Palestinians.
Yeah.
And so
Herculean
many of
task
them now,
ahead,
there is
really.
no shelter.
That was Amjad Shawa, head of the Palestinian NGO network in Gaza City. Thank you so much for your time and all the best for the work ahead.
Thank you.
And we're joined now by Altaf Musani, Director of Emergency Health Interventions at the World Health Organization. A very warm welcome to DW. After 2 years of war, can you tell us what is left of Gaza's healthcare system?
Anya, thank you so much for having me. Let me just briefly describe what the healthcare system looks like. 36 hospitals. We as the health community have worked to top up those 36 hospitals, so there's about 16 additional field hospitals. Let me stress, the 36 fixed and the 16 field hospitals, none of them are at full functioning capability. They lack the fuel, they lack the water, they lack the essential medicine, and most importantly, the workforce needed to be able to provide services when they're needed at most. That's just the hospitals. We could further unpack what primary healthcare looks like. Happy to also unpack what risk looks like to people as they move forward in this very difficult environment. And remember that not more than 2 months ago, a famine was declared in parts of central Gaza and was looming further on. So there's a tremendous amount of need. There's a tremendous amount of risk that exists in the healthcare system. We've had more than 1,700 healthcare workers who've died in the line of duty.
Have you been able to do anything at all that could possibly improve the really dire situation in the few days since the ceasefire began?
So I want to stress that the World Health Organization and its partners have worked with the Ministries of Health and UNRWA well before October 2023 and will continue to work in the days, weeks, and years ahead. Since the ceasefire, we managed to get 8 trucks of essential medical supplies in, what you mentioned at the top of your news hour. We managed to do an urgent mission to Al Ahli Hospital to provide it fuel and essential medicines. And then remember, Anya, we have been talking about this for some time. There's a tremendous need for medical evacuations. The partners at large, including the WHO, has managed to facilitate 5,000 children who need urgent medical care out of the Gaza Strip. But yet there's an additional 15,000 people who need healthcare and need to be medically evacuated.
I'd like to highlight a quote from your boss, the World Health Organization Director General, Tedros Ghebreyesus. He posted on X that Gaza's health system must be rehabilitated and rebuilt. This crisis, he wrote, gives us the opportunity to rebuild it better, stronger, fairer, and centered on people's needs. So, Altaf, tell us more about how this crisis might be able to be used as an opportunity for Gaza.
Well, further quoting my boss, he's been very clear about the fact that there's no health without peace and no peace without health. What does that mean? Those 36 hospitals I described, the 181 primary healthcare units, they're the ones that have been servicing the 2 million people in Gaza as this humanitarian crisis unfolded. We need to use the health system to garner support and services to those who need assistance. And let me be clear about this. There have been at least 170,000 injuries that we've recorded. We put out a recent report, which was an update from last year, that talks about, of those 170,000, at least 25% of those individuals will have life-altering needs for a lifetime. And so therefore, that health system becomes even more important to be able to provide clinical care in order to provide hope to those who need assistance. And to give you another figure, roughly 500,000 women have urgent needs. So where do they deliver safely? How do we tackle malnutrition? How do we bring that workforce back? These are all challenges that we need to work together as a community and ensure the positioning of and the availability of safe and accessible healthcare throughout the Gaza Strip.
Looking forward, how challenging is it to plan rebuilding efforts without, of course, knowing exactly who will govern Gaza in the future?
Well, those are definitely extreme challenges. And let me point out the fact that over the last 2 years, we've recorded more than 1,700 violations in healthcare. This has put a tremendous strain on that system that you described. The estimated needs are well more than $7 billion in order for us to rebuild. So there's definitely going to be long conversations on the financing side, long conversations on the security and the governance side. And the United Nations and the humanitarian community at large has always been present in order to scale up. Now is the time. We have the means, we have the material, we need the safe passage and the sustained access in order to support the people of Gaza who need us most right now.
Altaf Musani from the World Health Organization. Altaf, thank you so much.
Thank you.